What's in a name? Everything. It defines you, and that's why Nemours is unifying its brand. It will simply be known in the near future as Nemours Children's Health. Joining me on the morning show is the president and CEO of Nemours, Lawrence Moss. Good morning. Thanks for being here.
Good morning, Bruce. Thank you for having me.
Well, choosing that name was really meant to define your mission, which is to better reflect the organization's bold vision of redefining children's health. So what's the strategy? What's your vision for creating the healthiest generations of children?
I appreciate you asking, Bruce. Nemours, as the nation's largest multiple hospital, multiple state system of care for kids, has an agenda to transform the way America takes care of kids. And I would exemplify that in two main areas. First of all, we need a broader and more expansive definition of health in this country to something that happens primarily outside the hospital. And secondly, we need to transform the way that health care is paid for in this country so that the financial incentives of the health system align with the health incentives of the children and families we care for.
So if I understand what you're saying is we have to redefine some of the things that we've made part of our routine for years.
That's exactly correct. There's a mountain of evidence that tells us that about 15% of child health is due to superb medical care, which is critically important, and Nemours will always deliver superb medical care. But 85% of health happens outside the hospital. It's about good education, food security, safety, fair housing, all of those factors in which children live and grow and become adults. And we believe that children's health systems should play a part in ensuring excellence in all areas that affect a child's health.
You know, there's no doubt we saw with the pandemic, there's an inherent lack of trust these days. And that's one reason so many people refuse to get the vaccine, frankly. So how can this new approach help rebuild that trust and build relationships?
Well, that's a great question. And I think trust comes with credibility. And in many ways, our system of care in the United States has failed a big part of the population. If you have an incredibly complicated condition, the United States is the best country in the world to be, and we do a tremendous job of providing high-end, complex care. But if you're the other 99% that just wants to keep your family healthy, there are a lot of things that we can do better in this country, and as a leading health system, Nemours wants to set the tone for how we can step up and do better for all children in the country.
And we didn't get to where we are today and have the inequities that we have today overnight. So we're not going to solve all these problems overnight. It's going to take time.
It will take time, but I'm glad that you use the word inequity because that is at the root of what we're trying to combat at Nemours and what we're trying to improve. There are massive inequities in health in this country. So I'll just give you an anecdotal example. The infant mortality for African American infants in the United States is triple what it is for infants from a white background, infants that are white. That is unconscionable for a country that has the resources we have in the United States, and we have the opportunity to change that.
And you will be changing it because you've redefined your mission. And changing the name, I think, takes place in October officially, right? But you're working on making that change right now.
In the late summer, early fall, you'll be hearing more from us, but we're laying the groundwork now, and all of our 8,500 associates are engaged and participating in 6 different states to make this happen.
And we'll keep the people posted as to what's going on, as we always have here at Channel 4. Thanks for being here.
Thank you.